A very good evening to all our viewers and welcome to this edition of the Evening Review. My name is Toivan Jebela, your host. Tonight on the show we have the Minister of Health, Dr. Kalumbi Shangula. But before that, let's have a look at today's front page of Namibian Sun.
Just living dead.
So today on the show we are joined by the Minister of Health, Dr. Kalumbi Shangula. He's been at the forefront of the fight against COVID-19, of course, fighting from his portfolio as Health Minister. Welcome to the show, Minister Shangula.
Thank you very much. My pleasure.
Yes. Give us, I know that you've been doing a brilliant job insofar as giving those daily updates is concerned, but give us from your own mouth today, Minister, an overview of the COVID situation in the country as you see it.
Yeah. We are experiencing on upsurge, both in the number of new infections and also in the number of deaths. If we look from where we came from, we have gone last year through the first wave, then somewhere we went through a second wave, and basically these events they were associated with external events, which superimposed the easy transmission of infections. Currently, when the situation was improving, we have relaxed a lot of public health measures. This was done really to allow a semblance of normality and also to allow the economy to revive, to bounce back.
Yeah.
But it appears that these measures were not accompanied by a high degree of self-policing. We have seen a bit of complacency and behavior on a great scale that facilitate the easy transmission of the infection. We have realized that initially what we did is to try to reduce the number of public gathering allowed from 100 to 50. But then the level of occurrence was very, very low, to such an extent that the number remains on paper, but in actual fact, not being followed in practice. Concomitant with that is the fact that as we are approaching winter, people tend to remain in close settings, which facilitate easy transmission of infection. And that led us in the situation in which we are now calling the third wave. So basically, we are now at the peak of it, and the stocks talk for themselves, and they look very bad.
Indeed, indeed, Minister. Um, uh, in terms, one of the issues currently that not coincided, I think is a result of the influx of cases now, is the state of logistics. We are told hospitals are full, a lot of people are in ICUs, others are battling to get access to oxygen. In terms of logistics, what can the minister tell us today?
Well, in terms of logistics, we have created a number of additional space to cater for COVID-19 patients. And yesterday, during the press conference, I gave a breakdown per hospitals where we have created additional space throughout the country, and also including Finhook. And then, on top of that, we have also brought in additional supply of oxygen. I must inform you that under normal circumstances, we had oxygen generation capacity which was sufficient for the need of the hospitals, which mainly include the theaters, the ICUs, maternity, casualty, etc. Now, with the additional beds for COVID-19 which have been created, the distribution of the oxygen to different parts of the hospitals, especially to the COVID wards, brought a situation that the pressure became low. And for each endpoint, we will need 100 oxygen. You find that for each endpoint now, you have 100%, which may not be sufficient for the patients. We have now tried to add additional capacity of oxygen, but I must inform you that, the oxygen we are procuring from the suppliers. And then it appears now that the current demand is exceeding the capacity of the suppliers to supply the hospitals. We are now in such a situation, but the suppliers are trying their level best to acquire additional oxygen generating capacity. 2 weeks ago, when the situation was very dire at Katutura Hospital, the existing capacity is 5.7 ton. We have now erected the oxygen tank with a capacity of 20 tons. That is 4 times bigger than the current, and that should be sufficient for the whole hospital. But the level of consumption is such high that it needs to be replenished on a weekly basis. But the oxygen at the hospital is there. We are also seeing the demand going up in other places, including Vinu Hospital, including Oshakati Hospital, including Onanjokwe hospitals. And our idea is to put up similar facility at all those, but unfortunately, they are not available in the country. So that is the situation we are facing.
Well, what can you tell us, Minister, about the state of financial resources at your disposal? We know that there was a special budgetary provision made for ministry specifically to fight the virus. How are the reserves at the moment as far as finance is concerned?
We, at the present moment, we did get a budget during the appropriation parliament, which was actually to cater for the COVID need, and that was the time when we had the situation under control. But now with the increased demand, we need additional financial resources. But at the present moment, that is not our main concern, because government has given us the assurance that they will make, already we have identified additional resources within the budget which can be used to meet the current demand. So that is not really the major concern for us. The major concern now is to get the oxygen for our need. That is really the main concern, not so much financial.
And also, as a medical doctor yourself, Minister, a trained doctor, to what do you attach the increase? Not very much in the infections. I think you have explained that quite well, but in the increased mortalities, fatalities. Is it because of a particular variant, perhaps COVID variant, that has crippled into the systems, or is it? I mean, the numbers are staggering of people dying. To what specifically? What is your assessment of what is causing that particular state?
Yes, you know, the COVID-19 attacks the lungs, both inflammation and also reduce the capacity of the lungs to be able to supply the body with sufficient oxygen. Now, the lungs become so inflamed, even if you have got oxygen, when the lungs have been inflamed and they are no longer able to function, that leads to a situation what we call COVID pneumonia. You know, pneumonia, you can have pneumonia, which has been prevalent in all the countries, including Namibia. And used to have people who are dying of pneumonia if it's not successfully treated. But this is again a COVID induced pneumonia, which, and any pneumonia which is not properly treated, which is not adequate treated, which is not timely treated, even depending on the severity of the disease itself, it results in fatalities. So, irrespective of the variant, all the variants, they are very aggressive, they are very dangerous, and one the lungs become inflamed, it's no longer in a position to supply the body with the oxygen, even if it is available. And that leads to the deaths of the individuals. So the most important thing for us all is to have the old axiom which says that prevention is always better than cure. And all our efforts have been trying to say that let us trying to ensure that the people do not reach a stage when they would require hospitalization. It's easier to prevent the contraction of the disease. It's much cost effective to do that, and it can be very successful out. But let me just inform you that a disease which is driven by behavior, by the behavior of the people, is always very, very difficult to control. You can have all the plans, you can have all the control measures, you can have all the preventive measures in place, but if there is no concomitant behavior change to adjust to the imperatives of COVID-19, then obviously the transmission of infection will occur. And unfortunately, some of those individuals who are inflicted will end up in a hospital.
Indeed, and another challenge for you, Minister, is, and it's good that you mentioned behavior of individuals being out of your control. What is also out of your control to a large extent is the vaccination thing. So many of us have taken our first doses, and in my case, my second one is next week. But there are people who do not share the same view as myself as far as vaccinations are concerned. And that also is a problem for you as a ministry, just to have so many people. Of course, we have seen, I think lately, greater interest, but there are still pockets of individuals who do not believe in that, and that should be concerning to you, isn't it?
Yes, that is a really a major concern. You know, the government has gone to extend to ensure that we obtain the vaccines for the Namibian people. You know, vaccines against COVID-19 are quite new. Many countries are scrambling. Many countries are scrambling to obtain these vaccines. And some of the powerful nations would have secured the vaccines for their own people. Namibia is a disadvantage. Now, we do not manufacture our own vaccines. We have to depend on external sources. And number two, our population and our power is so limited. Our population is small, our buying power is small. Now imagine if you are a supplier, there is a customer who is looking for vaccine for 600 million people. And then here comes a country like Namibia looking for vaccines for 600,000 people. Obviously, from the business perspective, you go for where you can make a big return on your investment. And then countries like Namibia's will be at the tail end. That's the experience we have been having. But despite that, against all odds, we have been able to secure vaccines for our people. Now, once we have done so at great efforts, here comes some individuals who then claim that vaccines are not safe, vaccines are killing people, which then result in some people are believing and become hesitant to take up the vaccination. Unfortunately, the vaccine uptake at the beginning has been very slow. We are now seeing more interest in people coming for vaccination. We have seen that at our vaccination sites, as early as 6 o'clock, people are already queuing up to get their vaccine, which is a good sign. But we might have already lost time. And when the third wave arrived, a lot of Namibians have not yet been vaccinated. We have experienced a number of deaths, and I can tell you that among those cases, we are announcing every day those who have passed on. All of them, with the exception of about one or two who only received the first dose of vaccination, all of them have not been vaccinated. So now the question will be, do you risk to die of COVID-19, or you can go vaccination point to be protected? That is really the biggest challenge we are facing. But as I said, there are currently promises. A lot of Namibians are now starting to believe that vaccine is the solution.
Indeed. The final question to you, Minister, then is what can you tell us about, I mean, especially now that you and I are saying to each other that there's greater interest in people in taking the vaccination. In terms of your reserves for different types of vaccines that you've procured, what can you tell us as to the availability? Are we going to not run in a situation where the people become more interested and then the demand end up outstripping the supply?
Yeah, it's a very, very good question, and this points out to proper vaccine management system. Um, we we have diversified our sources of supply. Initially, we have been sourcing our vaccines through the COVID facilities. We continue to do so. Now, we have also approached several suppliers for vaccines like Sputnik 5, which is developed by the Russian Federation, the Sinopharm from China. We are also looking at other vaccines so that we do not put our eggs in one basket, but to source from all possible suppliers where we can get better. One thing we would not like to do is to buy more vaccine than we can consume, because some of the vaccines, like the AstraZeneca, has got a very short shelf life, and we wouldn't like to buy such a big quantity that we may end up destroying them because they might have already been expiring. So we are balancing very carefully not to run out of vaccines, but also not to buy too much that we are unable to consume at the end of the day. So this is being managed very, very carefully. And I can assure you that we do not, at the present moment, foresee a situation where we would run out of the vaccines. But I also want to say that the external market, they are unpredictable, because there are many things like the demand from other countries, the disruption in the logistics system in terms of transportations, and many other factors which we have to take into consideration when planning for the acquisition of the vaccines. And we are this situation very, very carefully, monitoring and scanning the environment to make sure that we serve the Namibian people to the best of our ability.
Indeed. Minister Shangula, thank you very much for your time. And before I let you go, I just wanted to thank you for two particular things in front of my viewers tonight. And that is, first, because by virtue of what is happening in the country now, you are the busiest minister in the country. You are overwhelmed with so much work. And somehow we can see your efforts. So we thank you as a country. I'm not speaking on behalf of the country, of course, but some of us really thank you for your effort. But secondly, from a media point of view, that you always have time to speak to us. We text you on WhatsApp, and you reply despite so much that is on your shoulder. Other ministers would ask us to go through their secretaries and their public relations officers, but in your case, you've always been very, very kind to us in providing timely information. So we can't thank you enough. But as we close this conversation, Minister, I want to wish you the best of luck in this very, very important fight of our country. And may you win this dreadful, the fight against this dreadful virus.
Public, which is a very good thing, because a nation informed is a nation which can make an informed decision. And I would also like to to express my gratitude to the public for the cooperation we have been receiving. Otherwise, we could not have achieved so much. And let me just emphasize the fact that we have actually achieved a lot under the circumstances, and this was really due to the public cooperation, and also sometimes when we see, when you look at the healthcare workers, they are spending day and night sacrificing their own well-being to help others. Words of appreciation really sustain them, and we have been receiving those through different means of communications, and these are the kind words which sustain the whole health workforce in their fight against COVID-19. We would like to appreciate that gesture from the public and also from the media. Thank you.
Thank you, Minister. I appreciate your time.